Basically, when we talk of surgically inducing a weight loss, the person's BMI should be 30 and above. That means they should be at least 30 to 40 kgs beyond their ideal body weight. And then if they are developing medical problems, like if they are becoming diabetic, if they are becoming hypertensive, or their joints have started to hurt, or they are developing snoring and becoming breathless if they are sleeping flat, what we call the obstructive sleep apnea. Now these are the indications that they should now put a sincere attempt to lose weight, and if they are failing the regular diet and exercise way of losing weight, then they should opt for bariatric surgery. Now coming to the next question, that what are the types of bariatric surgery? Bariatric surgery is a surgery on the stomach and small intestines, and the type of surgery depends upon the person's age, eating habits, and what are the medical problems they are having, and we decide the type of procedure. The procedures are divided into two types. One is the restrictive type of procedures, and one is the restriction plus malabsorptive type of procedures. So restrictive type of procedures, we have the procedure which is commonly done called sleeve gastrectomy, and in the combination procedures where there is restriction and malabsorption, we have the bypasses. So there are different varieties of bypasses, but most commonly done are the Roux-en-Y gastric bypass and the mini gastric bypass. Now the advantage with a bypass is, suppose someone is obese and has a bad metabolic syndrome, that is in form of bad diabetes or hypertension and dyslipidemia, the bypasses give not only a good weight loss but also an absolute resolution of the metabolic syndrome.